Welcome to Human Risk, a podcast dedicated to the understanding of human behaviour as a risk. Here's your host, Christian Hunt.
Hello and welcome back to the show. Now, if I say the word doctor to you in a medical rather than academic sense, you'll probably think of someone in a white coat with a stethoscope who makes medical assessments and prescribes treatments and drugs to patients, which of course is precisely what they do. But a word that probably wouldn't come to mind when you're thinking of that doctor is a coach. Yet that's the role that my guest on this episode, Dr. Ollie Hart, thinks is a key part of helping patients to live longer, healthier lives. Having worked as a general practitioner in the UK's NHS, that's the National Health Service, Ollie realised that in many cases, what would help patients weren't just prescriptions, but rather the kind of support that you might, in other contexts, expect from coaches. He's the co-founder of a healthcare coaching business that seeks to empower patients as part of the support they receive. As you'll hear, Ollie's not suggesting coaching is a blanket replacement for all forms of medical treatment, but for certain conditions, supporting patients through coaching can be incredibly powerful in increasing overall well-being. In our discussion, we explore Ollie's medical career, how he came to see the value in healthcare coaching, and how and where it can help patients, as well, of course, where it is less effective. As you'll hear, several decades ago, let's not worry exactly how many that is, Ollie and I were classmates. And because one or two of our teachers liked to have the class sat in alphabetical order, presumably so they didn't need to memorise anyone's name, we'd end up sitting next to each other. And thanks to LinkedIn, we recently reconnected and got talking again. In doing so, we realised that although we're working in very different fields, the fundamental principle of thinking about the humans whose behaviour we're trying to influence, in his case in a medical context, in mine, compliance, risk and ethics, is identical, which is why I really wanted to get him on the show. I think his approach is fascinating and it illustrates how, if we want to solve problems, particularly those obviously relating to humans, a behavioural approach of understanding what I refer to as not how we would like people to behave, but how they're likely to behave, can be really powerful. And not just in the medical field. The ideas Ollie is sharing have a much wider resonance. In a few discussions, we've already noticed some incredible parallels between our fields, and we're learning from each other as we talk more. In fact, I think we've probably learned more from each other in our recent discussions than we ever did in some of the classes we sat in together. So stand by for an unusual episode of the show, but for someone who's got some really fascinating insights. It's Dr. Ollie Hart on healthcare coaching. Ollie, welcome to the Human Risk Podcast.
Oh, hi. It's lovely to be talking to you again after such a long break, eh?
It's great. And so obviously, as you implied in that answer, you and I go way back to school days. But for those people that weren't lucky enough to be at school with you, can you tell my listeners a little bit about yourself?
Yeah, thank you. It's funny, isn't it, that we've known each other at school, knew each other as friends, and then haven't seen each other for 30 years, and it ends up we're in a similar sort of area, albeit very different contexts. It's amazing, isn't it? Love it. Yeah. Well, since we last knew each other, I've spent 30 years being a doctor. I trained as a general practitioner, a GP, spent 20 years as a GP partner in a practice in Sheffield. And along that journey, seeing literally thousands of people and having been trained as a medic, as a doctor, I realized that the things that really work for people that help them to improve their health and well-being goes way beyond the medical stuff that I learned at medical school. And I guess in that journey, realized that the skill set of helping people to look after themselves and to feel more autonomous in their own healthcare was actually much more effective than anything I could prescribe. And over the probably last 10 years or so, that started as a nagging itch, and I've sort of like grown it. 8 years ago, another GP colleague and I decided we wanted to sort of get more into it. And that field emerged for us as something we call health coaching. So it's a skill set around how do you, as a health practitioner, work in a way that enables the people you're working with to look after themselves and to do the bit they need to do well, really well. And we set up a company just as a hobby on the side. And over the last 3 or 4 years, we've got more and more into it as we've seen the impact. In the last couple of years, I've sort of stepped out of general practice, and mostly that's what I do now. I run this company teaching healthcare professionals how to use health coaching in their professional capacity.
Love this. And so really what you've done is, if I look at it sort of from a behavioural perspective, you spent a lot of time qualifying and getting some technical expertise, to use a sort of general term. And then in applying that, you've gone, well, here's another toolkit that would supplement. I find that really interesting that you've done that, because logically, if you spent a long time studying something, there's all sorts of behavioral reasons why you might not want to shift. So was that transition hard? Did that emerge over time? Was there a light bulb moment? How did you come to that realization?
Well, it certainly wasn't planned, and I think one of the most useful things you can do, isn't it, is to remain curious and intrigued throughout your career. And if you do that, you start to realize the stuff you've learned is always evolving, and you can tailor what you're doing. But I mentioned I set up a company with a GP colleague, Tim Williams, and we were actually both working in the pain clinic. We were GPs that had a special interest in people living with chronic, long-standing pain, and that's an awful condition, but very, very common. And we started from the point of view of doctors, of sort of giving prescriptions and doing injections. I'd been an anaesthetist an earlier part of my career, so I knew how to give big injections and epidurals and so on. And I think, a growing realization over time working in the clinic was that the interventions really didn't have a massive impact. They might get people out of a hole if they're really stuck, but maybe that's about 1 in 20 people where it had a significant effect. And in the other 19 out of 20, the thing that really made a difference was people developing their own self-confidence and their understanding what was going on, and how they then sort of learn how to manage their own condition. And we realized that what would make us really effective as doctors in that setting was to become good at the skills that we could do to help support them in that. So we didn't know at the time, but that's what we evolved into health coaching. And what's lovely is that recently the NHS, in the last probably 5 years or so, has also come on this journey as well, and realized this is something that we ought to be more proactive about generally. So we've had the opportunity to train health coaches across the country, and other roles like social prescribed link workers and care coordinators that use a lot of coaching skills. So it's been great. It evolves. Life evolves, doesn't it?
And I love that, because this all comes from the place that I guess you don't go into the medical profession without wanting to help people. I mean, there may be a few people that don't, but generally speaking, it's a vocation. You've got to commit to it early. There's a ton of studying to do for very good reasons on behalf of the rest of us. We want you to have studied and know what you're doing if you're going to do things to our bodies and encourage us to take drugs and things. But you've basically gone through that. And what you've done is taken that passion and gone, actually, I want to be even more effective. And I love this idea of taking the vocation and just saying, actually, I really, that's the focal point. And that's what's taking you, I think, to where you are now. Because on the one hand, if I looked at it dispassionately, not being in the medical profession, I could say, well, that obviously actually it makes sense to do things around the medical piece, and getting people to think about their habit is of course going to be helpful to them. But that might not be obvious coming through it. And so I love that what's shone through in the conversation I've had with you and the way you're talking now is there's a clear passion for helping people. So this is entirely consistent with the medical mission, if you like.
I think so. Yeah. And I mean, it's lots of reasons, isn't it? People go into medicine. I think you get a lot of positive reinforcement from the moment you've sort of mentioned that it might be something you want to do. Oh, that'd be wonderful. Yes, you can go and help people. It's a wonderful career. And you sort of get that. So you can get a bit carried away with that. And to be honest with you, actually, the reality of being a doctor, especially at the moment, it's actually really quite hard work. You're in a profession where you're spending most of your time when people are distressed and upset and frightened. That's quite a hard place to be, actually. But one of the things that I've discovered about the coaching sort of journey I've been on is that if you kind of come at it from a point of view of you're the one that's going to solve all the problems, it's on your shoulders, you're the man, you've done the studying, and actually it comes with a sort of ego with it, doesn't it?
Right.
But that comes with a huge pressure as well. So I think part of this journey has been a bit of a sort of realization that sharing that burden and taking more of a partnership approach with people you're working with, as well as being much more effective for them, has been a little bit of a sort of pressure relief, and it's enabled me to carry on with enthusiasm and joy, really. And I think that's really important in your job, to discover that.
And I love this. It comes through in the way that you talk about it. But presumably what you're doing now is shifting away from talking directly to patients. You're now working, as I understand it, with medical practitioners. So you're helping them. So it's a different angle on solving the problem. Is that right?
Yeah, to some degree. I mean, I still do some face-to-face practice with patients, because again, you get that immediate feedback. Then it's lovely. It's sort of, particularly once you learn to coach. If you practice medicine in a coaching style, like I say, you're working in partnership, and that feeling of working in partnership with people as they go on the journey is really self-affirming for you as a professional. And I think to some degree, you have to still be at the coalface to really be part of system design. But again, probably a bit like you, for the same age, you get to that point in your career where you realize the way the system operates has a huge influence on people's ability to do things professionally, or for, in my case, for patients to achieve good outcomes. And you become interested in how you can play your part to positively influence that system.
Love that. And as you were talking, I was thinking about the phrase bedside manner, because actually there's something interesting implicit in, there's an expectation that a doctor is going to know what they're talking about, but also be
Mm.
good at communicating and be sensitive to people's needs, which plays into, which is why it's so exhausting, right? You're not just kind of rattling off, I don't know, like a car mechanic might say, you need to get these parts, so that's what you need to do for the car, right? You've got to handle the fact that this is people's health, and they're going to have emotions about it in ways that, people have emotions about cars, but they're not in the same way. And so there's something interesting there, I think, about we would like our medical professionals to be more than just repositories of information about how the body works. We actually want that bit. And so again, you're tapping into something that I think probably from the consumer perspective, I'd really like my medical practitioner to have that. But until I spoke to you about it, it hadn't occurred to me that that wasn't naturally in the toolkit of everyone. And I think it's really interesting that you've grabbed something that, certainly from the consumer end of it, I love it when you talk about these things, because it's exactly what I want. I don't just want a solution that involves take these pills. I want something where I can feel part of, I can do something and I can feel part of it. And I feel like somebody's
Yeah.
actually thought about me as opposed to providing a generic solution.
Yeah, it's interesting you said that. And I think probably one of the things we've learned with the health coaching journey is that people start from different sort of points, different skill sets, different social context, different life opportunities, if you like, really. And I suspect someone like yourself is pretty adept at sort of, navigating what's good for you. And so
In
you
theory,
are,
yeah.
we talk about an act. Yeah, well, in theory, yeah. But at least your brain is tuned into it. We talk about the sort of language of patient activation, which some people hate, but it's quite useful, really. It's this concept that people do have different skills, knowledge, and confidence to look after themselves. And when people are highly skilled, it doesn't take very much, just a little bit of education, maybe even a little bit of directing, and some advice. But most people who are at low levels of activation, where we might traditionally have sort of just said, look, just follow what I say. Actually, people need a much more tailored approach, which is more about building their self-confidence and finding reasons to get involved at all. Because actually, although you might see the benefit of it, for most people, the sign of being healthy is not having to think about your health. You don't really want to spend all your time keeping yourself healthy. You just want to be healthy and live your life. So often you're sort of having to negotiate with people that it is worth them spending a bit of time and effort investing in their own health, whether it's physical or, often mental well-being. It takes a bit of effort. So part of this is about negotiating with people. Okay, you're going to get the best out of me if we do this in partnership together, which means you're going to have to take perhaps a bit more of a role than you've been taking up to now.
I love that. I think that's a great call out of me, actually, because you're right. I was imputing that everybody else, I guess, has the bandwidth, the intellectual capacity, just the interest in it. And so what you're pointing towards there is, not everybody, surprise, surprise, not everybody's the same. And so we need to think about flexing those things. And I think that again points to, if I looked at what you're doing and compared it with the work that I do, it's very much coming at it from the other angle. Think about, like, how do we deliver something to people that can really be effective, not theoretically effective, but practically effective. And so there's a little bit of a sort of customer experience type focus on this, right? They might not necessarily they might not feel positive about the message, but you've got to send them away from whatever engagement there is, feeling like they can do something, that they're empowered, that they know what they need to do. And so it's not necessarily a pleasurable experience, because often medical conditions aren't fun things to talk about, but you've got to give them away with that positive sense. So I guess you're really looking at it from the patient's perspective and thinking about what's going to be most effective for them. And it's not just about what's theoretically most effective. It's actually what will work for them in a particular instance. And that goes beyond just taking pills and knowing about it. It's thinking about other aspects. And so you've got to get inside their head. So the overlap, I think, between what I'm doing and what you're doing is, and there are lots of them, is I think when I'm looking at compliance programs and saying what we need to do is understand, well, what does this feel like to be subject to these rules? And then we can try and structure things. I guess you're looking at it and saying, what does it feel like from their perspective? How can I get them to work with me? And so you're really, in many respects, putting yourself really into the patient's shoes.
Yeah, absolutely. Yeah. There's so much overlap in what we do, isn't it? It's fascinating, really. And particularly, I really like the fact that you draw attention to people's context as well, being so important, how they behave, which I'd love to come back to. But it just, one thing you sort of made me think there is I think it's quite important to draw the distinction when we're talking about this between sort of acute medical conditions and long-term medical conditions. And I've spent most of my life as a general practitioner, but I spent some time as an anaesthetist. And when someone's had a road traffic accident or they've got an acute condition, we've got a new diagnosis of cancer or something, those sort of conditions, you've got an infection, you've got a broken limb, you want the medical profession to jump in and to sort of like to do the decision making for you and to act quickly and to be very directive, and they're the ones
Right.
they're the ones in control, right? But more and more now, our health is determined by our long-term conditions, be they physical things or mental or emotional things. Things like chronic pain, chronic anxiety and depression, they make up a huge amount of what influences our health. So you don't really want coaching in an acute setting, but in a long-term setting, that's where it really comes in. And I think it's interesting thinking about the rules because to some degree, we're also having to shift patients' appreciation of the rules because in a way, we've been quite conditioned as a society into that acute model, which is there's something, something wrong. The doctor will diagnose it. They'll give me a quick fix. I just have to follow those instructions. And it's quite cognitively simple for people it's easy. Great. I don't have to do anything. Whereas actually, when you're thinking about the chronic sort of conditions, which are much more prevalent now, the rules have changed a bit. And the rules are now that actually you're going to get better outcomes if we do this together. But I think there is still a bit about making people aware that those rules have shifted.
So it's almost like what you might say sort of car mechanic or plumber logic, right? I want my car to work. I want my toilet to flush. I don't actually need to understand how any of this stuff works. And I'll pay someone else to come along and solve that problem for me, which is the sort of the medical thing. I'll go see the doctor because he or she will fix it for me. But actually you're pointing towards something where you might not want this, but you're going to have to develop a level of not necessarily expertise, but you're going to have to develop an awareness of what is going on in order to help me solve the problem. And I like that bit you said about the cognitive simplicity, because we in a stressed world, right? It's much better if I can offload something to someone else and get them to take care of it. That's one less thing I need to worry about. And particularly where it's
Absolutely.
something significant like health, you sort of think, well, and I'm really struck by this concept of relative expertise, because obviously whenever you have a medical condition as a patient, you're suddenly required to develop very quickly you learn things that you never knew you wouldn't need to know in any other circumstance. So you know nothing about something until you need to know everything. And so I think there's a fascinating thing there about thinking about that is, in the way you were talking about it, that's a difficult process for people. I don't want to have another thing in my life where I have to develop another skill and a knowledge, but that's really important because, as you say, if we're sophisticated about how we look at people's conditions, it isn't just a case of taking some pills. Actually, it's your entire lifestyle and how you're treating yourself and the environment that you're in. And so I love this idea of recognizing, what's the cognitive load on people. And if we start to recognize that, then we can start to design things that will genuinely be effective, as opposed to saying, well, theoretically, you ought to understand this. You ought to know this because this is important to you. That's never going to work. That doesn't work in other contexts. So why would it work in a medical one?
Absolutely. And you are so right there when you say that it's a cognitive load. And so I guess, people have to go on a journey, don't they? And initially, all right, there's something I've got to do. I've got to learn it, which creates a really difficult cognitive load. But I guess the real secret, I think, of what we're trying to do is if you can embed those as habits in your life, then it stops becoming a cognitive load because it just becomes the way that, you don't have to, you stop thinking about it again. You go back to your, it's the whole Daniel Kahneman thing, isn't it? Fast and slow thinking. If something is just how you've automatically always done something, it's easy again, isn't it? So there's a journey, you're aware of it. You've got to make some changes. That's tough. But once you've embedded them as new habits, it's easier. So, if actually, you habitually now walk to work rather than get in the car, then after a while that you don't even think about getting the car keys. You just walk out the door with your coat on. Same with your food choices or your exercise regime, or even your mental health, the way you think about yourself. If actually your automatic approach to think about yourself is a bit self-critical and blaming and overly worrying and stressing about things, that becomes your normal process, your habit, doesn't it? Whereas if you can reframe those and retrain your brain for your habits to be a bit more self-supportive and nurturing to yourself, actually, life's pretty tough. It's pretty tough for everybody. You're doing a pretty good job. Yeah, it's not surprising that some of those things aren't going well. That's the same for everybody. That becomes the new habit, and it again becomes easy. So you've got a lovely place to get to, but there's a journey to go on.
And I love this idea. I mean, you mentioned your diet and fitness as good examples. I think we all intuitively understand the idea of exercise if we can build that into our normal regime. And we've seen, the entire business is built around making that happen. So Peloton's a very good example of let's put the exercise regime in people's houses. We've got apps that can help us. Ditto with diets. You've got companies that will deliver prepackaged food to you that gives you just the right amount of whatever you need. And so I find it fascinating in many respects that these ancillary areas have adopted this. And yet when you talk about in the medical profession, it's almost, I love the fact that you're doing this, but it's almost astonishing to me that this hasn't really been done before. It seems kind of obvious, but then that's always a with hindsight thing.
Yeah, it is, isn't it? And I mean, you could be a bit conspiracyist about it, couldn't you? But often the way professionals work is driven to some degree by the financial model, isn't it? There's always been quite a financial model around prescribing medicines and interventions, which is pretty easy to monetize. And also there's a sort of huge professional status and esteem within the medical profession. And I can say that being one of them, that kind of like quite likes the dependence on the doctor knowing best and taking the lead. We've struggled, I think, to kind of create a commercial model that sits around people doing things well for themselves. And interestingly, it's sort of been led sometimes by the health industry, isn't it? That want to sell you apps and they want to sell you kind of personal trainer programs and so on. But what I'm really interested in with the company that Tim and I have set up, Peak Health Coaching, is how can we make this kind of mainstream for the NHS, the way our core health services, that we all contribute to with our national insurance, how can we make that the kind of best source of this sort of support that's universally available to everybody in the way that the rest of the NHS is?
And you mentioned vested interests. I mean, it seems to me that potentially, I mean, you could sort of say, well, this is, heretical in one extreme, where you're coming in and saying, you're trying to undermine these processes. But I think what's interesting about it is the way you talk about it is because you've been through this. And I love the idea of keeping your hand in, right? So that you know what you're talking about. And as you think about developing solutions, you're still at the coalface on some level. But this is, in a way, this is requiring a bit of a radical rethink. And so you are up against, I think it's interesting because I think as with all behavioral challenges, you've got the behavioral challenge of patients and the behavioral challenge of introducing the behavioral thinking into whatever it is. And so there's a double challenge you need to think about in terms of how you, not only is the business delivering behavioral change at the end, it's also, you've got to persuade some people. So you've got to be conscious of that in how you deliver your service, I guess.
Absolutely. And it's not about telling that medicine's been wrong. In a way, you try and think about the narrative, don't you? I've been thinking about it recently. Thinking,
you're getting it all wrong. I mean, that's like a never a winning strategy.
And it's not true. I mean, but for me, it's not either or. Sort of like I think it's a little bit like saying we've been practicing healthcare in a sort of one dimension, which has predominantly been the medical dimension, and we've got very good at it. But actually, we ought to be working in 3D. Life is in 3 dimensions, and healthcare should probably be in 3 dimensions. And the additional dimensions of what people do to look after themselves and how we work on people's social context that enables them to do that well are the other 2 dimensions. So sort of self-care and considering your social situation. So we can enhance the medical model. We can enhance healthcare by turning it from a 1-dimensional approach into a 3-dimensional approach. So it's not that we want to stop doing the medical stuff. It's not that we want to stop prescribing things necessarily. It's just about, I guess, rebalancing that picture so that we are being mindful of all 3 dimensions, not just focusing on one.
And I was smiling as you're talking because I sort of had visions of you could be portrayed. These are the witch doctors, right? Let's get rid of all this newfangled stuff, right? And we'll go back to basic things. And of course, there's an element I think of that does play to our basic human things is that actually it's in a way, I think it's quite nice to have alternative solutions. Now, I know some of the, there's some people out there preaching appalling things that are just plain wrong. But I like the idea of actually, well, there are some other tools in the toolkit that we can think about if we want to get through things. Then actually recognizing that there may be techniques that we can use. There may be other things we can think about: the food that we consume. Maybe we can think about what we drink. We can think there's all these other aspects about how we view life, and so that does play into almost there's a primeval thing here, I think, where yes, of course, we want the simple. The 21st century me wants the technical expert. This is complicated. I don't want to have to think about this stuff. But on the other hand, I also quite like some solutions that play into a basic human recognition that actually there are there are some things that we've known for centuries about how to look after ourselves. So I think it's very forward looking, but I also think you're playing to quite a basic human desire in some respects around some of these I'm not talking about wacky traditional techniques, but some of the more
sensible techniques that one can look way back and say when medicine was less sophisticated, there were some things that were along the lines you're talking.
Yeah, and I think it's not necessarily going backwards. We've progressed a long way, haven't we? But I think to some degree, it's about adapting how far we've developed, because a lot of the stuff that's now causing us problems in that sort of self-management and social context are of our own making. We've created quite a toxic environment. We've created an ultra-processed food environment. We've created an environment where people generally don't need to move much. There's a lot of air pollution around. So there's lots of stuff that we've created. And we've also, to some degree, created this narrative that your health totally depends on the medical profession and on health interventions, which also undermines people's autonomy to look after themselves as well, particularly with your mental health, I think, So in a way, some of it is about reestablishing other stuff, but other bits is...
You've talked a lot about health coaching, but I think it's probably helpful to know what does that actually involve?
So, I mean, for me as a doctor, if you think, is there any part that the person needs to play in looking after their health condition or their own health? And like I said, if the answer is actually at that moment, no, it's an emergency, the healthcare professionals need to take over, then the answer is no. But most of the time, the answer is yes. So health coaching is the skill set around how can you support and encourage and challenge people so that they can take the best role they can looking after themselves. And as we've sort of said before, it will be different from where people are at. So we think about tailoring your health coaching to people's baseline skill set and knowledge and the context they find themselves in. So we believe that that's something that all healthcare professionals should play a part in. But in fact, the whole team really. So, there's a role that someone can play even at the front desk of the GP receptionist, let's say, in the way they ask you questions, the way they encourage you, that sort of almost signals that the role that people play is as important as the rest of the team. But then obviously it comes into it with the doctor and the nurses, where they may be wanting to sort of make sure they're covering the medical stuff that they're trained in, but they're also signaling, look, there's a big part you may have to do here. They might ask a few questions or push a few buttons on, encouraging people to think about things. But then we're moving towards people that have more time to actually health coach with people, which might sometimes be doctors and nurses, but often these days it's dedicated health coaches that might have more like 45 minutes, an hour with somebody who can really enact those skill sets of how do I support you to feel more confident and more skillful at looking after yourself.
I love that. That's super interesting. And I really like the bit you talked about the role of the receptionist. On the face of it, that sounds like, well, that's irrelevant, right? There's an administrative role. They're there to do air traffic control in the diaries. But actually, I think that's a really astute observation, because that sets the tone. That is the first point of contact. And so if I took the logic of, I don't know, customer service logic, for example, or when you check into a hotel, or when you phone up a business, or when you get to a restaurant, that first point of contact is super important for setting the tone in lots of different ways. And so I love the idea that, yes, you're looking at the obvious bit, which is the medical piece, but you start with that. And I think that's really, really interesting. And is often overlooked because it seems, well, it's ancillary, it's not relevant. But actually, when you take, back to the flipping things from the perspective of the patient, you're absolutely right. The nature of the conversation that you have, and I've had some appalling ones where, they're legitimately trying to triage why I'm phoning up to book an appointment, but it feels like some sort of weird interrogation. I do not think these people are on my side, and maybe they're not, right? Maybe the instructions they've been given are to put people off and do whatever. But I love this idea of you think about that as well, because that's a key component. And we know that in other contexts. And I think it's super interesting you're focusing on that in this one.
Yeah, and it's a subtle thing, isn't it? And it is about creating a culture, and you've got to be careful with it, haven't you? Because to give it some real life examples. So there's two things I think the receptionists can do really well. They can sort of get people thinking about what they're doing, what people are doing to look after themselves. So one of my favorite questions is, tell me a bit about what you're doing to look after yourself at the moment, particularly if they've got diabetes or mental health. What do you do? What do you do to look after your mental health at the moment? And you don't have to be a doctor to ask that question. By asking, you create that culture that there's going to be some things the doctor might support you with, but there's going to be a whole load you do yourself. So if your receptionists have got that kind of rapport with their people, they might be seeing people quite often. They come in and out, they might build up a kind of relationship where they can sort of say, how's it going? What are you doing? Oh, I'm doing a bit of mindfulness. I've started to, walk around the block. Oh, brilliant. How's that going? They can create that culture of being interested, but also messaging that what you do yourself is really important. But you got to be really careful, haven't you? Because if that becomes a sort of feeling of like, well, actually, we're not going to let you see the doctor unless they know that you're holding the stuff, it can feel like a bit of a barrier, and sometimes a bit of a blame thing. One of the big things about this is that, again, the unintended consequences of this is that people feel, a sense of failure or a sense of blame if they're not doing everything they could do. And I think that, again, is a really important part of the culture, is that we recognize there are very good reasons why sometimes people can't look after themselves. They've got other priorities, looking after elderly parents, looking after kids, trying to manage a very stressful job where they're trying to keep 30 of their employees in work or something. There's lots of very altruistic reasons why people may put themselves lowest on the list, So it's not about creating a blame or a barrier culture, but it is about creating that sort of sense that it does matter. It does matter the part you play, and we're all in it to try and support you do that as best you can.
But what I think is really interesting about this is that you're right. It needs to be handled sensitively. And so, there's an art to it, and you could get it badly wrong. But what's interesting is when people might say, well, that sounds risky. Why would we do that? But my response to that would be, well, your receptionists and everybody else in your organization is setting a tone anyway. Right. It's not like there isn't a sort of sense of what am I going into? And so you're taking something. Yes, it might feel like, the more you say, well, this needs to be sensitively handled, the more you go, well, that sounds like a high risk strategy. Let's stay away from that. Actually, you're already doing it. And so inadvertently, the phone call that you have, the receptionist, or the contact point, the discussions you have, they're setting all these tones. It's, to use behavioral science terminology, there's no such thing as a neutral choice architecture. On some level, you are creating an impression. And we're very adept at picking up on that. And so I think you're not opening up a whole new can of worms here. What you're saying is let's recognize the power that these things have. And if we do these things deliberately and intelligently, then we can use moments that might otherwise be lost or unhelpful to be even more helpful.
Absolutely. It's the whole system, isn't it? And that it's difficult because sometimes that can just grind you down. You think, I can't control all this stuff, but you can do little bits and pieces. We can train GP receptionists to be aware of the value of this and to have sort of, not all the time, but to have different conversations. But it's interesting as well, sort of the message that goes out in the public. I mean, at the moment, for instance, there's a narrative out there, isn't it, that, we want to get better access to GP appointments, and that's all that matters. And in fact, in primary care at the moment, that's one of the key targets, can you get access to a GP? And I work as a GP, and I know that getting in front of me for 10 minutes or 15 minutes is not going to be the thing that unlocks your better health for you. It might be part of the journey, but for many, many people, it's not the panacea. So there's this kind of, in setting this as the holy grail, right? How quickly can you see your GP? It almost suggests that is the only thing that's going to get you better. And so I'm sitting on the other side of that thinking like, oh my goodness, pressure on me. Actually, what really does matter is that the whole system is able to support you in looking after yourself. And that isn't dependent on seeing me. It's dependent on a whole lot of other things. So that's, you asked me why I got into this, is because I've realized from lots of personal experience that we need a system that operates in a different way. And we can do it. We can definitely do it. There's some very proactive things happening in the NHS at the moment. The last 5 years, we've been setting up what we call primary care networks, which are collaborations between GP practices and voluntary sector organizations and patient groups. And there's been a real focus on those three dimensions, the medical, but also the self-care and the social aspect. And we've made a lot of progress in that. It's been really exciting.
I love that. And it's that classic, what you've talked about there, it's that classic, what gets measured gets done type logic. And so I hadn't ever thought about it, but you're absolutely right. You put that up there. Of course, people are going to go, well, if that's the metric that's out there, that's the thing that they're delivering, that must be important. And therefore I must strive. And you make the problem worse because you increase the level of demand, because that's got to be the important thing. And so in trying to, and we can argue about whether this is, the politicians are doing it for the right reasons, but if we put that up there as a flagship thing, then you're right. You've absolutely stated that this is the most valuable thing. And if you get anything else, you're being fobbed off. You're not being given the top quality service. And to your point, that may be true. There will be things where you absolutely do need that. But actually, if we can start to get an idea that it's much more than that, just that one thing, I love that thinking, because you're right. Then, of course, it becomes a pressure point. And of course, people are going to feel like, if you're being triaged in a way, it feels like you're being held off from the Holy Grail, because that's for more important people And so you can see how that breeds resentment and challenges. And of course, to your point, putting pressure on you as well. So I love that. In a way, it's undermining the entire object of the exercise, right? Which is to make people better.
Yeah. Can I just
yeah.
say, you made me think there, because measurement's such a tough thing, isn't it, in any system change? And I think comes into your sort of humanizing rules as well, is that you can put rules and measures and targets in place. But for me, that's a really clumsy way of trying to change culture. If those things won't change your culture, if you haven't got a culture where you all actually value these three dimensions of, medical, but also self-care and the social situation equally, then if you put measures in without getting that culture change, you'll actually make things a lot worse. So, there are measures I think you could put in place that will be really good at valuing those new sectors, but you've got to do the culture change bit first. So, I'd love to sort of like for us to think, okay, if it matters people's self-management skills, let's ask people, how confident and skillful do you feel about looking after yourself? What things might you need to help build that self-confidence? Similarly with the social sort of thing, it might be, how much does your social situation get in the way of how you look after yourself? What's holding you back? What social connections have you got? How many neighbors do you know? All those sort of, you could put markers in those other two areas. But if you only put the markers in and then kind of hold everybody accountable to that without doing the culture change first, that's definitely a kind of recipe for disaster. So we've got to be really careful about when we put the measures in, have we done the culture change bit first?
I love that. And all of this just starts to feel, I don't know, just it almost, the bit I really struck me is that I'm somebody that will do the classic male thing. He said stereotyping hugely of kind of like, I'm not going to go to the doctor unless it's really, really bad, right? Which is not, I know is not a smart way to manage one's health. But I do sit there sometimes with some of this stuff and go, I don't want to waste the doctor's time. And so if I thought about the impediments for me using the health services intelligently, I think a lot of what you've talked about is some of the structures that are put in place to manage, for example, number of appointments. There is an element of people feel like, rightly or wrongly, the triage system putting on, and there's a huge amount of pressure. So I don't want to add to that. And so I might try and, so you hear it in dentistry, people sort of doing self-service. And I could imagine people trying to solve their own medical problems where really they do need help. And so what I think is interesting about this is the whole, you're looking the service and what is that from a completely different angle, which is to say that this doesn't change the core proposition that you will get help with those things, but actually let's build all these other things in so that we can get better value for money out of this, but we can get a much better experience out of it. And I think it comes back to your point about it being much more human, because actually if you get it right, then this isn't this big intimidating process where I come along and feel like I'm going to get told off. It's actually, there's much more to it. And I think sometimes there is a sense of, like going to the doctor, it's a big thing and it shouldn't be a big thing, right? We should be doing it for the right. Equally, you don't want people turning up and time wasting, which I imagine is also an issue. So it's thinking really intelligently about a problem that we have, having a very human approach to how we solve a human problem.
Oh, absolutely. I think that's what I found really interesting about our worlds colliding, is that we've realized that actually you might think in a sort of technical world like compliance or technical world like medicine, that what really matters is how skillful our technology is and how deep our knowledge is and so on. But actually what really matters is the human interface and our self-confidence to do stuff for ourselves, making the most of some of the tools that are there to support us, but it still comes down to the human factor in the end as being the biggest indicator of whether or not things work.
And so if I looked at you've said, and I love the intro to how you came to this, right? Which is just a realization that things could be done differently and things could be better. You haven't gone into this as a sort of like, here's a theoretical business plan that I think will work because I've analyzed the market segment. This is lived experience where you've gone, I think we can do better, and let's do something that's there. And of course, you want to you run a successful business, but if I looked at it, what does success look like for you? Because what you're tackling here, and we can start and say the microcosm of the UK, but clearly, and there'll be countries that do it differently. I'm currently in Germany where there's a lot more sort of alternative healthcare. I mean, if I go into the supermarket, the amount of teas that I can buy to solve medical problems is insane. So there's a sort of opposite extremity of that kind of alternative healthcare that's quite prevalent. So we have different countries have different systems, but presumably this is a global thing. I mean, this challenge of how do we combine what I might sort of term hard medical and some of the softer stuff, that would apply. It's globally applicable, right? So if I looked at it and said, what's the ultimate vision? You've got something that could resonate, albeit under different circumstances on a global basis.
Well, it'd be lovely to think that. I mean, I guess our core premise for the company is that we're trying to create a coaching culture in the NHS. We really believe in the value of the NHS and universal access to free health. And you could maybe argue a bit, but actually the beauty about the NHS is it's not really consumer driven. It's not supply driven. It should be based around the needs of people. And I think that's a really healthy place to start a health system from. That's definitely where we're interested in going with it. But I mean, it was interesting what you said there about the male thing is to think about putting off going to the doctor. But I wonder if what will be interesting is if you might sort of say the male thing is to put off thinking about your health at all. Actually, once you realize that your health is very much related to what you're doing as well as your access to the health system, you might start to reflect a bit of like, well, how do I need to sort of just have a little think about my situation? What is it that could be contributing to how I'm feeling or how I'm coping or the symptoms I'm getting that is genuinely your own autonomy and control and not necessarily driven by people want to market stuff to you. And I think sometimes I worry that the tea selection is mostly driven by people wanting to sell tea to you rather than everything you need in your life. But if people start to feel, hard to capture, but if people start to feel a greater sense of autonomy around their own health and well-being, that stems from a coaching culture in our NHS. That, for me, that will be success. And I don't think I'll do that on my own. And I don't think I'll probably achieve that in my life. But if we can play a part to that journey, that would be really deeply rewarding.
But I love that. I think there's nothing wrong with having a really, really big ambition, because if you don't,
big area goal, isn't that what Jim Collins said?
Exactly.
A BHAG. Have a BHAG.
If you don't start with that, then you'll, by default, your imagination and the way this might go is tricky. And it just struck me that, particularly post-pandemic, the digital communication and Zoom and those sorts of things have really blossomed in ways that I think probably would have happened, but it's become much more prevalent. The idea of picking if you say, let's just do a call, then in many cases, that natural presumption is that's a video call, right? Using one of those platforms. And so what you've got is something, because you're dealing with teaching people to think differently about something and teaching people soft skills, the potential is there, right? The potential is there for this to be a global thing. And I could see that you could easily, this will transplant itself. Clearly you have to work out how you scale it, but there's clearly an opportunity here to go global. It's not something that would just apply in one market, and the technology and the acceptance of those things are there.
Sounds like you're angling to be our global manager for us. That's what we need. I mean, it's lovely to think about that. And but hearing you talk, it sort of almost, the danger of some of these conversations, it can feel a bit like sort of, how does that actually play out? So interesting. I'd love to just sort of maybe just talk about one person who is a really good little microcosm of this. A guy called Frank, who I've worked with for many years, that he's very happy to talk about him. But the kind of exceptional thing really is that Frank's not that unusual now, actually. It's really a common scenario. But someone like Frank, so when I first met Frank, he was that person that felt like he was going to be told off when he came to a doctor. It was really interesting. He's someone who lived with type 2 diabetes, and he came in to tell me that he'd read a few books and made some changes to his life, and as a result had stopped his own insulin injections, which, you think, what a terrible thing to do. And he was a new patient with us, and he said he was really prepared to come in for me to tell him off and tell him he'd been stupid. But luckily, I guess I was into the sort of the role that people can take themselves. So I sort of shook his hand and said, that's fantastic. It's amazing. How did you do it? And he taught me a lesson that at that point I never knew. I never knew that people with type 2 diabetes could stop their insulin if they changed their diet significantly. And so Frank taught me that. And through that, I learned that, if you give people the right support, I mean, Frank had done it for himself. He'd read a few books, but if you can give people the right support, they can change what they do. So my relationship with Frank has grown over the years, being his doctor and patient, sort of 10 years on now. And he's had ups and downs, and I've had to put him onto medications sometimes, but we've worked really in a partnership way. And over his journey, he's lost sort of 4 stone in weight. He has mostly done that through sort of lifestyle changes, mostly changing his diet. And the support I've given him is how to sort of weather the storm and cope when life gets tough. But what's been really interesting about Frank is that he now helps me to sort of teach other people as well. So we actually run a course together, the two of us, where we get patients in and we take them from that first point of like, well, where do I start? And what sort of bit of knowledge might you need? But then, how do you build your confidence and how do you build your why, if you like? Why should I bother making this effort, as we've said, to get over the sort of cognitive hill to start off with and establishing new habits? But we're doing it together in partnership. And he is now starting to lead groups himself on his own.
Oh,
so
wow.
Patients, other patients. So you've got this whole kind of like new system emerging where you value the self-care role. You value trying to, help people feel more confident. And a lot of that is sometimes working with other people like you. You talked about that in your book, and how the influence of other people on each other is so important. But I've seen that firsthand, how that dynamic can play out. And you change your relationship as a doctor with your patients, you change your culture as a community. That diabetes sort of program we're doing now, we're building up more and more peer champions who understand how to support other people, usually through having done it themselves. And that it's a different culture. It's a whole different approach to medicine. And it's really, really lovely.
I love that. That's brilliant, because it's a sort of, in a way, it's an entrepreneurial approach, but we're in a and what you're doing is basically saying, keep going, and I'm going to support you in that. And I think to have what's interesting there is that would require either quite a lot of self-belief, and clearly you don't want to advise people that they should always be work it out for yourself before you come and see me.
Frank was unusual.
Right.
Yeah, Frank was unusual. He taught me, absolutely, yeah.
I don't know if you come across this. There's a lady called Julia Enders, a German lady, who's written a book on the gut. Have you come across this?
Oh, no, but I do know a lot about the microbiome.
Right.
And how
So she had, it's a similar story to what you've talked about. And she was, I think, sort of 16 or something, and had a skin condition and kept having to take all sorts of creams and tablets and whatever else. And it wasn't helping. And she was like, well, I'm going to research this myself. And so went away and discovered that it was all to do with her gut. And so she changed her diet and solved the problem, and then wrote this book that became a best-selling book on the gut. And it's been reviewed by medical professionals, and they were like, this is spot on, right? Really, really good stuff. And then the bit I love is she then went to university to study this thing. So you've got her sitting in lectures, listening to people where she probably knows a decent amount of stuff. But it was this idea of taking responsibility for yourself. And I think what you talked about there is, again, it's interesting because what you've provided is an environment where you're supporting that process as opposed to stamping down on it. Because, in your example, he was going to do it anyway. And so what you're doing is recognizing that intrinsic motivation to do it and saying, how can we do that? And so this is why I think, it's a great illustration of why you call it coaching, because you're supporting someone who wants to do, if somebody doesn't want to be coached on something, it's not going to work. So there has to be that willingness on their part to do it. And so I think the terminology, that's a really good illustration of the terminology that you're using, because that's why it's coaching, right? It's not, you're not telling them to go, you need them to work with you. And so you have to create an environment where they want to do that. But then it's about making sure that you support and nurture them through that, as opposed to just being the person to tell them what to do.
Absolutely, completely. That's the essence of coaching, isn't it? And the key thing about coaching is it's not one size fits all. For someone like Frank, who'd taken a lot of leaps himself, actually, most of my coaching role was just fine tuning what he was doing already. But for many other people, actually, the hardest thing is I guess, engaging at all. And, there's lots of really good reasons why people are in a sort of toxic relationship with their own health. It's a bit like any kind of relationship, isn't it? There's lots of reasons why you can often stay in a very unhealthy position. Sometimes it's just that you feel powerless or frightened to change. Sometimes there are some secondary benefits to you. Sometimes there's very strong social reasons that are keeping you there. And so often coaching people at those early stages, it's very tempting in healthcare. Sometimes just say, they're not ready yet. They're not up for it. They're not motivated, not committed. So we do try and avoid saying that. And actually, but the first stage of coaching is finding out what's happening in someone's life. What really matters to you? What are the really important things? What resources and assets have you got you can draw on? And how can I help you make those very early baby steps of just shifting your mindset to kind of going from a point where you think there's nothing I can do here, I'm totally at mercy of my life, to actually, okay, I'm starting to feel like there is something I can do. It's going to be really tricky, and I'm really frightened and nervous about it, but I can do it. So that very early step of coaching is different to the later on thing like I did with Frank, but nevertheless, it's all coaching.
Wow. I love it. Just the way you talk about it is super inspiring, because it's really, and again, I keep saying this, but it comes back to that. You genuinely want to help people, right? And so what you're trying to do is to work out, well, actually, and the bit that you've done, which is the bit that I did in the space, is the filling in the gaps. It's like, okay, if I want to get this outcome, I need to understand what motivates people. And therefore, I have to understand the realities of human decision making. And I thought some of the factors you listed, they're obvious, but you can overlook them, or you can sort of go, well, that shouldn't be an issue, right? They should make the time because this is important. And actually, it doesn't matter whether they should do something. It's about what are they able to do? What are they willing to do? What are they capable of? All of those things. And so I love the fact that the solution that you have designed is one that is built around actual humans making real decisions in the real world, as opposed to the theoretical world that we like to have. And that's where I think the parallel with what I do is, where you can design rules and processes around how you'd like the world to be, but we have to look at how it actually is. What are people likely to do as opposed to what we'd like to do?
Yeah.
And so I really like the way you talk about it.
That was definitely the phrase in your book that really stuck in my mind. I was just going to highlight that up. Exactly. And that does counter the narrative of individual blame, doesn't it? That sort of, actually it's mostly how the system's set up. There are definitely some skills and knowledge that you can teach people if that's lacking. If they don't know the rules and they really don't understand what's going on, then you're going to have to plug a gap there, aren't you? But actually a lot of it is around enabling it to happen and how we operate as a whole team. Yeah, absolutely. Yeah, that's such the similarity, isn't it? People will generally behave in the way the system drives them.
As we think about this piece, I mean, one of the things that always fascinates me is the idea of placebos, and obviously that's used in medical testing to see whether just how do we know drugs effective? Well, we'll give some people a placebo and some people the real drug in the same condition, and then we can work it. And that always struck me as an interesting thing, because in some cases placebos work. Right, you could sort of put it in the mind over matter category. And I'm fascinated. Presumably, you're open to. I'm not suggesting that you're immediately saying let's replace all drugs with placebo, but that sort of thinking, is that something that fits within it, or?
Yeah, absolutely. I mean, I think the placebo effect is so important. We tend to discount it in drug trials because what we're trying to test out is whether or not drugs work or not, and we want that to be an additional benefit to placebo, but that shouldn't mean that it's a sort of insignificant thing. Actually, the placebo effect is a very, very important part of what helps people to feel better, isn't it? And isn't it a weird thing? You sort of think if people feel sort of safe and secure, or like something's being done, that actually your health outcomes genuinely improve. You get better through just feeling safer and more secure. And so much of that plays into what we know about how the brain works and the neuropsychology of things. Chronic pain is a fantastic example of that. Was where Tim and I started. That actually there are, of course, times when biological signals from our body stimulate the brain to make pain. If you've had a broken leg or you've got sort of a terrible erosive cancer, you're going to get pain from that because of the signals from the body. But a lot of the time, the signals are being generated because our perception in the brain is that we need protecting and we're not safe. So it's really common when people can have an injury. The injury is healed up, but the brain is still left nervous about moving, and so it continues to make pain. So a lot of what we're doing in pain management is helping the brain to feel safe again, and you could call that the placebo, and it's often a bit of a derogatory term, isn't it?
Right.
It's the placebo effect. The placebo effect is so important, and it's not actually always easy to induce. But effectively, what you're doing is you're reprogramming your brain. You're recognizing that the way the brain works is mostly through running software programs. We're all familiar with computers. Computers stop working because the software's crashed. That's often what happens. So the placebo effect, in a way, is a bit like us rebooting a program that's crashed to make it run more smoothly. And that's a really powerful thing to do. I think coaches do that really well. Coaches, I wrote a blog about it recently. Coaches help people to reboot and rewire the brain so it works better again.
I love that as well, because you sort of think, well, if you looked at customer experiences, right, things that make our lives more pleasurable, often those are illogical things. So you can think about, nice cutlery or nice wine glasses doesn't change the flavor of the wine, right? It's the same thing you put in the bottle, but it can make it taste better, right? Just because and so on the one hand, I think, well, that's ridiculous, right? Why would that? But then you go, well, if it works, then why wouldn't we use that in a positive sense to recognize that we can create outcomes that do come from intangibles that make no sense whatsoever, And yet they obviously work. And so I love this idea of just seeing what, because this is about how do we get people in the right place? How do we get them
Yeah.
thinking in the right terms? And so if there are techniques that are effective, and we can see all around. And this is, again, this is why I think where our worlds collide is I look at it and go, if you want to get people to follow a set of rules or principles, then have a look at who else is getting people to do things in completely different contexts. Right? Advertising, good example. They manage to persuade people to buy products and services. So I can use that logic. I'm not saying we slavishly copy it, but I go, oh, that's an interesting way of doing it. That, you don't spend money on advertising if it doesn't work. So that gives you a sense that it must be on some level. If somebody's been running an ad campaign for some time, it must be effective in some way, shape, or form. And so we can learn from that. We might do the opposite, or we might try and copy that thing. And so, but we can borrow that. And even if it doesn't make no sense whatsoever, we can all think of advertisements that are ridiculous that clearly work. Otherwise, they wouldn't put the money behind it. So if that works in that context, I think there's no reason why, if we're trying to do the same thing, which is to get people to a specific place, to follow a process, to engage with something, there's no reason why we shouldn't borrow that. And so I love, again, this is where we overlap. It's just like, let's bring in these things that might seem silly or frivolous, if they can help us get to the end that we're looking for. And being, for me, it's just about being open to the fact that might be a possibility, because then your toolkit gets much bigger, and actually you can start to potentially save money, be more effective, and let's be honest as well, have a bit more fun. Because I think sometimes there's a conflation of seriousness. Serious subject equals we need serious communication. So actually, we know that often, like, we want to have fun because we're humans.
Yeah, absolutely. And that's the way to unlock the brain often, isn't it? To be playful with it. And I think that's why I really like working in the NHS, because I think the focus on the NHS is less about selling things to people and about a commercial model of health. There are commercial factors in it, but actually, because it's free, we are, you've got to be careful about quackery, haven't you? And sort of, emperor's new clothes, really, and sort of trying to kind of promote something that just really doesn't work at all. But at the same time, if there are sort of tricks and skills you can teach people that enable the brain to think more helpfully about your health and then consequently have less symptoms, let's make the most of them. Let's use those skills alongside the medical skills. I come back to that 3-dimensional approach, moving from a 1-dimensional approach to 3-dimensional. You don't want to throw out the really fantastic health progress we've made. But I think it's important to recognize that the skills to coach people's self-management are equally as important as the medical model.
Wow. I love that. I think, Ollie, that's the perfect note on which to wrap things up. I know you and I are going to continue having conversations and finding crossovers and everything else.
Yeah, please,
but I want to say, firstly, thank you for coming onto the show. It's been great. It's been an absolute pleasure catching up with you in general, but thank you for coming onto the show. Before I let you go, tell my listeners where they can find you and find out more about what you do.
Yeah, thanks. Well, our company is called Peak Health Coaching. We have a website, peakhealthcoaching.com, where we show details of all the training that we offer, mostly in the NHS, but it's applicable, like you say, across the world, really. And then I'm on LinkedIn, at Ollie Hart, Sheffield, if you want to add that in. We're also on Twitter. I'm at Ollie Hart 7 or at Peak Health Coach. Those are probably the best places. And I'm really receptive. I love conversations. So please do message me, sort of on Twitter or LinkedIn. And I love to get conversations going. It's fascinating. So if people listen to this and want to talk more or feed in their views, no one's got the answers to this. This is just about opening a different dimension of conversations and hopefully making it apply in the end. But we've all got to do this together. So I love having conversations.
Love it. Links to all of those things for people that didn't have a pen to hand or can't remember that far back will be in the show notes, so people can just click through there and find you those ways. Thank you so much for coming on the show. It's been an absolute pleasure, and I'm thoroughly looking forward to further conversations.
Oh, likewise. Thank you. There's lovely questions, and it's just lovely when you have synergy between two areas, isn't it?
Totally agree.
So that's it for this episode of the Human Risk Podcast. My enormous thanks to Ollie for appearing and to you for listening. To find out more about Ollie, his work, healthcare coaching, and a few of the things that we talked about on the show, have a look in the show notes. There are links to those there. If this is your first time listening to the Human Risk Podcast, welcome. You can subscribe wherever you get your quality audio content. It's available on all of the major podcasting platforms. If you like the show and have yet to leave a review for it or rating, please do so. It really does help. To discover episodes of the show that you might have missed, visit the show's website, which is humanriskpodcast.com. I'll be back very soon with another episode of this show, but in the meantime, stay safe, and thank you so much for listening.